So this morning really is to give you a little bit of feedback on our experience so far on public hearings. We've had two so far. Just to remind everyone very quickly, in case there's anyone who doesn't know, basically the new pharmacovigilance legislation allowed us or gave us the legal basis to convene public hearings within defined safety referral procedures, namely Article 20, 31 and 107I. The main aim to hold a public hearing is really to get information and insights from the general public. The key is that anybody can apply to attend. They are also broadcast live, and they're usually about half-day meetings. Now, we took quite a lot of time to get ready to hold these hearings because it was quite a big change for us in addition to the methods that we already used to gather patient input. So we had a public consultation, and we even had what we called an internal dry run, where we did a sort of mock public hearing so that everybody really could get a feel for what it was going to be like. I think nobody really expected or knew what would be the outcome of the first one. So the day came last year in September, and we had the first public hearing for Valproate, which is for the treatment of epilepsy, bipolar, and in some countries for migraine. Now we publicized the outcome, the announcement of the hearing as much as we could. We didn't really know how much interest we would get at the time, but we were very pleased to have almost 90 applications overall to attend the hearing, 32 as speakers and the rest as observers. Now, for us, the challenge was how could we really get as many people to be able to speak and contribute? And so we came up with the option to group some of the speakers, because obviously some from the bipolar groups or the epilepsy groups had very similar things to say. We approached them and asked them, would you be happy to group together and have a key speaker? And they were very open to this. And so this allowed us really to, in the end of the day, have 25 speakers contribute, but within 16 speaker slots, which is obviously, I can assure you, is a much more manageable amount to have within a sort of half-day meeting. So that was one of the key elements. I'm going to go straight to what was the impact and the value that we found from this public hearing. And we can say that what we got out of it really was central to the overall assessment of these medicines. It helped the committee really learn about and understand the real problems in clinical practice and for patients using Valproate. And this is kind of information which would not necessarily have been available if we hadn't have held a public hearing. So I think just to say that this was key throughout the procedure. What happened after the hearing was the input we heard then led to the questions and the content of the subsequent consultations that we had. It didn't stop at the public hearing. We then had a stakeholder meeting where we brought those key people back again to have a more in-depth discussion. And once we'd come up with the proposals, we then had a written consultation where we showed them the proposals and again got their feedback on what they thought about them. The kind of things that they highlighted were that there was perhaps a lack of communication on the risks to the patients, there needed to be better visual warnings, better information within the package leaflet, and perhaps better, more regular reviews for the women taking the medicine. And then these information that they gave us was then fed into the measures that were coming out. I won't go into detail because Eustaquio will give a much more detailed presentation in the next slide. But just to say there was tangible information that we received from all the different stakeholders that then led to the actual proposals and new measures at the outcome of the referral procedure. Now, of course, this is more the content that we heard from the public hearing, but of course for us it was also very important that we were making sure this was practically working in the best way. Were we making the right kind of forum? Were we holding it in the best way to make sure that people could easily contribute? So after everybody had participated, both the public participants and the PRAC members, we sent out questionnaires to them all, really asking them from the beginning, did you get enough information to prepare yourself? How was the conduct? How was it afterwards? All various details. And we got quite a good response rate. And of course, we analyzed all of this to see where did we need to make any differences or any changes, or where could we improve. And we were really pleased to see that not only the content of the hearing was successful, but also it seemed from the feedback that everybody was very happy with the way that it was conducted. Most said that it was overall well conducted, but also importantly, the participants, the public participants, said that they felt from participating that it would make a difference to the PRAC's recommendation. And the PRAC members equally said they felt or they knew it would make a difference to the outcome. So I think this just highlights that it wasn't just a public relations exercise or a tick box, that it did make a difference. So we took all of this on board. Moving forward, we thought, well, it seems to be working, so we don't need to make any major changes. We need to remain flexible. Some of the key things that we felt helped it work were the individual assistance that we gave to all the speakers. They were all called up individually, so they really knew what to expect and how they could best contribute. We prepared a lot of guidance documents, a video, a very easygoing question and answer document. The fact that we grouped the speakers together to really have the maximum number of people able to feel that their voice had been heard. The fact also that it was broadcast live. Spending most of the time for the hearing on those speaker sessions, so very short introduction and sum up, leaving the key amount of time for those speakers. Also as well allowing clarification after each speaker from the PRAC members so that they could elaborate on something or really have a bit of an exchange, that it wasn't just one after the other listening to everyone. And again, at the end, we had some time left over at the hearing and we opened it up to anybody, so including the observers, so that they could come up and then add a few words as well. And I think that also just add to the fact that it was spontaneous and it wasn't all planned, you know, and I think that's important, that it was a genuine thing. Obviously, there were a few limitations. I would say the key one from this Valproate hearing was that we had a majority of the patients coming from the United Kingdom. Only, I think, 4 or 5 other countries were represented. So we needed to make sure for the next hearing that we improved our outreach to wider European countries. So the next hearing we had was this year, earlier in June, and this was for quinolone and fluoroquinolone antibiotics. And again, we weren't quite sure how much interest we would have. This was very much about the persistence and severity of the side effects. Now, this is different because it's not defined disease area. But again, we were overwhelmed. We had even more applications than we had in the first hearing, with 120 people applying to attend, and a lot of speakers as well, 55 speakers now. Perhaps they'd seen the first hearing and that made them feel a bit more confident, but it was great to have so many applying. Again, we tried to initiate the concept of grouping them. It wasn't quite so easy in this sense because, as you can imagine, it's not a disease area grouping. So here we tried to look at making sure we could have representatives from as many different EU countries as we could, and also those that were highlighting a specific issue. So in the end, we had 23 speakers selected, and all the rest, obviously, even the speakers who couldn't come, who couldn't speak, were invited to come and attend the hearing as well, and they had an opportunity at the end to speak. So again, this referral procedure is still ongoing, so obviously we're not concluding on it yet. But again, some really important themes and information was highlighted. I think a lot of the patients explained their stories of how wide-ranging and how severe and long-lasting the side effects that they had had, which perhaps wasn't always understood. They perhaps hadn't been given enough information about those particular risks, and that some healthcare professionals were not aware of the extent of the side effects beyond those related to the Achilles tendon. And then again, the input we received through this hearing led to the subsequent expert meetings that we held. We held SAG meetings in each of the areas. And there were a lot of tangible, really useful proposals as well. It wasn't just people sharing their stories, but they also gave us, from the healthcare professional side and the patients, concrete proposals on how we can improve moving forward, that these antibiotics should perhaps be restricted in their use to last line where there really is no other options, that we need to improve the education that is given to healthcare professionals and the general communication on the toxicities and in the product information, to also manage the side effects that a lot of the people are still experiencing year after year, and encourage further research on the cause of the side effects. And also something that was highlighted that hadn't been brought up was that some patients felt that certain foods also affected the symptoms, and that was something new that was highlighted. Again, we sent questionnaires out, we gathered feedback, and quite similar to the first hearing, everyone seemed to be quite happy with the way that it run, and it was successful. I won't go into the details. I just put here some of the qualitative feedback we received from everybody, because obviously we gave them some scoring questions, but also some open text as well. Generally, it was a good experience. They felt that the committee had been very open and engaging with them, and understanding, and they were very impressed with the general openness of being able to come into a regulatory agency and just get a little insight of how things work. We kept everyone up to date as well. You know, once they came in and they, after the hearing, we kept them all up to date on what the next steps were and where we were with the procedure, and what the outcome was to each of them individually. So I just conclude to say that our experience from, okay, perhaps limited 2 public hearings we had, I think it went beyond our expectations in terms of course, it's quite resource intensive to hold these kind of hearings, but it really did make a difference in terms of the committee was able to get information from those prescribing and using medicines that it wouldn't have had necessarily. It made a difference to the information that they had, and so to the outcomes. It also allowed everyone to listen to each other. I think it's interesting for healthcare professionals to listen to a wide group of patients as well, and vice versa. Generally, obviously, it increases transparency, it's broadcast, you're bringing people in, and I would say that we will continue to learn by experience as well. I think a lot of things have worked so far. We need to make sure we go along that line, but also to be flexible and see if things need to be tweaked and be open about that as well. Thank you.